India is experiencing a rapid rise in COVID-19 infections as the Omicron wave hits the country. New daily cases have surged to almost 250,000, the highest number of infections since late May. This despite nearly 70% of all adults having received at least one dose of a vaccine. Even though fewer patients with Omicron infections are being hospitalized, this new wave has hit hospital staff hard, with hundreds of hospital and other frontline workers falling ill. DW reporters in Delhi looked into what can be expected as India confronts the new variant.
A new year, a massive new wave in India. After months of low infection rates, COVID-19 case numbers have shot up. The third wave of the pandemic has the country in its grip. The positivity rate in Delhi of those being tested is at 25%. Experts say the actual figure in the capital and the country is many times higher than that. Most scientists now agree that Omicron is driving this wave. While many Indians are anxious about the increase, others say things may be easier this time around.
We have to be careful. The third wave is here. I'm here at the hospital with my mother, who's a patient. We have to take extra care here because it's quite crowded.
I've been hearing that this time the virus is spreading much faster than before, but I don't think it is as dangerous because people are recovering quickly at their homes.
Dr. Karthikeya Kohli says the severity of symptoms and rate of hospitalization may be low with Omicron. But people still need to be very cautious.
Delta involved the lungs quite a lot, whereas in this one it is only related to the upper respiratory tract. Hence the symptoms are faster, quicker, and the recovery is quite fast actually.
But he warns that given the speed with which the virus is spreading, people are still at risk, especially older people and those with pre-existing conditions. Studies suggest that the third wave will peak sometime around January end to February beginning, and then we'll see a sharp decline. Even though this wave is expected to be short-lived, experts say that it still has the potential to overwhelm healthcare infrastructure once it hits its peak. Public health officials are worried that the spread of a highly infectious variant in a country of 1.3 billion people could have serious consequences.
If we let the virus have its way, possibly we'll see it rise fast and then also decay fast, maybe in the next 2 to 3 weeks. But it is in our interest to stretch the wave so that you do not simultaneously have a large number of people falling ill, because that can be very disruptive.
Efforts are being made to avoid the massive upheaval of the Delta outbreak. Indian authorities have implemented weekend and night curfews to slow the spread. People are hopeful this wave will be shorter and they will be spared the hardship so many went through less than a year ago.
For more, we're joined now by Lancelot Pinto, a pulmonologist in Mumbai. Dr. Pinto, we heard in our report that the symptoms in this Omicron wave are often less severe than with the Delta variant. Is that what you're seeing?
Hello, Terry, and thank you for inviting me to the show. That is exactly what most of us are seeing among our patients as well. So it's generally fever for a couple of days, a lot of body ache, a low backache, a sore throat, and occasionally loose motions is what we're seeing for a couple of days. But the prolonged fevers, the lower respiratory symptoms, the bad cough, the drop in oxygen that we frequently saw with Delta is not something that we're seeing this time around, thankfully.
In our report, we also heard that doctors want to stretch the Omicron wave so that Indian hospitals are not overwhelmed. Do you think the government's measures, such as local curfews, will be enough to achieve that?
So I think if there's one thing that we've learned from the past two waves is that overcrowding leads to a lot of super spreader events, and preventing overcrowding is the number one priority. And I think, hopefully with the installation of some curfews over the weekends, with prevention of people gathering in groups such as marriages and limiting the spread in that way is going to help us to a great extent. However, I think it's equally important to push up vaccination. A lot of individuals still haven't received their second doses of the vaccine. I think that's important. But it cannot be stressed enough that we need to flatten this wave as long as possible, because an entire country falling ill at the same time could lead to disastrous consequences, even if a tiny fraction of them need hospitalization.
Are you confident, Dr. Pinto, that India's healthcare system will be able to cope with the expected surge?
I think the key this time around is going to be how we manage hospitalizations. Individuals need to be encouraged as much as possible to manage their illness at home, knowing that this is self-limited for most individuals. India tends to be a country where a lot of healthcare is paid for out of pocket, so there's sometimes a lot of pressure to get hospitalized by patients, even when they don't really warrant hospitalizations. As long as we can manage a lot of the illness at home and reserve our beds only for the tiny fraction which really needs to be hospitalized, hopefully this time should be a lot better than last time around.
Dr. Pinto, thank you very much for your insights. That was Dr. Pulmonologist Lancelot Pinto joining us from Mumbai.
Thank you.
And joining us now from Delhi is DW's Manira Chaudhary, who filed that report. Manira, this new wave has hit hospital staff hard in India, with many falling ill. Give us a sense of what the situation is like for healthcare workers there.
Well, as the report suggested, hundreds and hundreds of healthcare workers, doctors, nurses, and other frontline workers have fallen sick in this wave. Now, in some other situation, like in the second wave, this particular situation could have easily overwhelmed the healthcare infrastructure. But what is happening right now is, as the reports are suggesting, as the doctors are suggesting, the symptoms this time around in this particular wave are quite mild, much milder in compared to the Delta variant, mostly for most of the people. So we are seeing a very low rate of hospitalization. We are not seeing the kind of rush of people that we saw in the second wave. So hospitals are not overwhelmed. So even if a lot of healthcare workers are sick with COVID, the situation so far is being managed. But of course, important to remember that we haven't hit the peak yet.
What steps is the government taking, Manira, to ensure the situation doesn't get out of control as it did in previous waves?
Well, the government so far has taken the basic steps. It reviewed the international travel guidelines a few weeks ago. Many states like Delhi, the capital city of Delhi itself, have implemented restrictions like night curfews and weekend curfews. Public spaces like restaurants, gyms, spas, and movie theaters have been shut down. Offices are being asked to operate from home. So, and of course, the government is encouraging people to follow COVID-appropriate behavior. So these basic steps are being taken so far.
I understand that India has started giving booster shots to healthcare workers. Are there plans for providing that shot to the rest of the population?
Yeah, so the government is following the same pattern that it did when we first started administering vaccines in the country in the first place. It is, at the moment, it has started these booster shots for healthcare workers and people above 60 and also who have underlying pre-existing conditions. So it can be assumed that probably once these two target groups are aptly covered is when the vaccine will be available slowly to the rest of the population. And also alongside, the government has started the first dose of vaccines for adolescents between the age group of 15 and 18 as well.
Manira, thank you very much. That was DW's Manira Chaudhary in Delhi.